Hi, my beauties. So it is a Saturday morning. My kids are entertained, the house is quiet, and so I want to post a YouTube video. So I'm trying to be consistent and post a YouTube video every weekend, and the weekends are easier because I'm not at work and hopefully my kids are not running around and I'm able to just connect with you guys. I'm like in my lounge clothes and nothing's perfect, and this video is not going to be polished or edited, but I wanted to get content out there to you. So I wanted to do a video on lip lines and how to address lip lines, because I recently posted an under eye video where I talked about under eye rejuvenation, and I had a lot of comments asking, hey, Dr. Capel, can you post something on lips and lip lines and how to erase what we call smoker's lines, which aren't really even from smokers because not many people smoke anymore these days, but these little radiating lines that you get around the mouth. And we get those because of eating, talking, using our mouths, in a natural way. For decades and decades, we start to get little creases in the lines, which we call these radiating lip lines, that sometimes happen above the lip, sometimes they happen below the lip. And it just happens because as we get older, our skin thins. So the epidermis gets thin, the dermis gets thin, and so wrinkles start to squish and accordion on each other when the orbicularis oris muscle, which is the muscle that goes around the mouth, constricts and moves as we talk. The skin starts folding and wrinkling when it didn't do that before because the skin was thicker. So there's usually different ways that you can erase lip lines. Filler is one of the mainstays of therapy for lip lines. Filler is what you do when you want immediate results. You'll walk out of the office, the lip lines will be 90% better, and then over the course of the next week they'll be 100% better. And even with the most etched in lip lines, I've been doing this for 20 years, and I've gotten very good at erasing lip lines using filler without making the volume of the lip look bigger, because that's something that is a problem with filler. When sometimes you go to an injector to fill in the lip lines, and they fill in these lip lines, but then you feel like you have this weird mouth ape face because the volume is too much in the lips, which, okay, yeah, your lip lines are gone, but now you have this like excess volume. So it's all about balancing it out. And I have a technique and I have little tricks up my sleeve that I learned along the way. You have to remember, I'm 45 years old. I've been in school for 20 years. And back in the day when I was a green medical student, I used to leave the lecture hall and go follow the derm residents and ask them if I could inject with them. And so I've been doing this since I was like 22 years old. And so along the way, you've perfected things. Not only with injecting lip lines, but just fillers in general and aesthetic procedures, making it look like nothing has been done, but what you're trying to erase gets erased, right? So you want your lip lines to be gone, but you don't want it to look like you have any filler there or any increased volume or change the appearance of your face, because then that's not even worth doing the procedure if it's going to, change the way you look or be obvious that something was done. So what usually happens is doing a little bit of filler in that area and balancing it out with the rest of the face. So a lot of mistakes that people make when their newer injectors are just starting out, or maybe they're not well trained, will just inject the lines and then ignore everything else. The key is that you want to inject into the lip lines, but you also want to inject into the red part of the lip and like even the area around the mouth to just kind of blend it in. And some people need it, some people don't. But if you're a patient of mine, you'll know that I'll say, okay, this is going to be stage 1. We're going to erase the lip lines and make it take successive approximations to our goal. It may take a couple sessions with me, but we'll do little bits at a time. So it's very inconspicuous. It looks very natural. Nobody will know, not even your partner or spouse or mom or whoever, closest friend, best friend, will even know anything was done. And each time you just kind of build on that. And it usually takes about 2 to 3 sessions at most, and we can erase those lip lines. So there is an art to it, and it's not just as simple as putting filler in there, because, you can get these like band-like, almost like cords in the lip lines if you're not injecting it correctly. You have to cross-hatch it, you have to blend it in, and everybody's different. So sometimes people will just need the upper done, sometimes people will need the lower, sometimes people need a little bit in the middle of the bottom lip to balance out the lines that were corrected on the upper lip. So there is an art to it, but there's a way to get them to go away without looking like anything was done. Your lip lines are gone. So, and it's taken me 20 years to perfect this. So I wanted to mention that. But then also there's other treatments for lip lines too. For people who don't want to go the filler route, Botox can help. So doing Botox along the upper lip here, usually it's 1 unit, 1 unit, 1 unit, 1 unit, and sometimes you can do 1 unit on the lower too. And it just softens that orbicularis oris muscle to help, stop contracting that skin to make those wrinkles. Now, you can't do too much there, because then the things that you naturally do, like drink through a straw, talk, kiss, spit out your toothpaste, things like that. So you don't want to weaken the muscle too much. I mean, you can do enough Botox in the mouth where all the lines are gone, but then if you can't use your mouth, then there's no point in that. So there is a limitation for Botox, and Botox usually lasts longer when you put more in. So because we usually go light around the lip lines, it doesn't last as long. It doesn't last like 3 to 6 months. It usually lasts for about 1 to 2 months. So that's just something to be mindful of too. Now, Botox for lip lines is different than lip flip. Lip flip is when you do it a little bit above right here, and what lip flip does is it keeps the upper lip fuller when you smile, so the muscle doesn't contract and the lip doesn't curl under, so your lips look fuller when you smile. But it's around the same injection site that you use for minimizing lip lines too. So the third thing for lip lines, well, there's many things for lip lines, but my third favorite besides Botox and filler is lasers. So doing a Fraxel laser, which is like Fraxel Restore, the non-ablative Fraxel, not the one that causes, bleeding and pinpoint bleeding and oozing and all the scary things that you can find if you Google like a Fraxel laser. Usually that's more fully ablative, CO2, erbium. But if you do a Fraxel Restore, which is a non-ablative laser, and you do several rounds of it, it can definitely help soften those lines. When you combine it with fillers, it's even better, because the thing is that even if you laser the lip lines and the lip lines get smoothed out and your muscle is still moving and your skin is still thin and it's going to still recreate those lines later, it's better to have a little bit of filler in there to erase the lines, and then you Fraxel on top of it to smooth out the surface. If the lines are pretty etched in and deep, you have to combine that therapy. Sometimes not, but lasers are really great, but yeah, you usually have to be in combination with another treatment. Otherwise, yeah, your skin's going to look great and the wrinkles will be softened, but then you're going to keep using your mouth and you're going to get in the same problem again. The other thing that you can do is smooth threads. So PDO threads are made up of the same component as like Sculptra and some of the biostimulatory fillers. Threads are biostimulatory, and they could be used, threadless can be used to like, lift and tighten and pull, and can be used for like non-surgical face lifts, neck lifts, brow lifts, but they also are very collagen biostimulatory. So putting smooth threads in the lip lines has also been shown to boost collagen and to smooth lip lines from that mechanism. To be honest, doing smooth threads isn't going to give you the results as like, having me do Robella or do an injectable filler on you, but it's another treatment modality, and sometimes people are very opposed to fillers, and so that's a treatment option as well. So you can sometimes combine these things, like you could combine smooth PDO threads with a laser surfacing, maybe even some Botox, or just one or two of them, or all these treatments combined. But we definitely can. I don't want you guys to think that you can't do anything about lip lines, because I've had numerous patients come in saying, I've just been living with these for 10 years because they drive me crazy, and everybody says that I can't get rid of these lines without looking like I have too much filler in my lips, because that's not true. You're just going to the wrong injector. So I wanted to do a lip line post, and this isn't lip augmentation. I'll do a whole separate video on that, because lip injections are really a fun topic too, and I'll do another YouTube video on that. But I wanted to focus on lip lines today for those of you who specifically asked me to do a YouTube video on lip lines. So that's my little lip line lecture for the day. I hope you guys enjoy this. Subscribe, hit the notification bell, because I've been more active on YouTube. I'm going to post one video each week, and I'm here for you guys, and want to be here to answer your comments and questions, and respond to you with talking about topics that you guys want to hear about. So I'm your personal dermatologist here for you, and be sure to subscribe and share this video with someone who may find it useful. All right, you guys, I love you. Happy Saturday.